Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County here in Oregon. I understand we have viewers from around the world, so Douglas County, Oregon in the U.S. Here for our Facebook Live event on today, April the 2nd. Again, this is a chance for you to ask questions. We've already had a few people put in questions at Facebook questions at douglaspublichealthnetwork.org. And we'll get to those first. And then if you have questions, do them, and one of our staff will put them on the list, and I'll try and read them today. The questions that people put on the Facebook questions, we get a chance to review beforehand and sometimes have to look the stuff up. So if you do have questions, don't hesitate to use that. As always, we start at the world level and then move down to the local level and then go through some interesting news of the week. Well, in the world, we're definitely in the next surge here, whether we call it the third surge or the fourth surge, we're clearly there. And in the world, we're now up to a number of daily cases almost where we were at the winter peak. Not quite, but almost where we were at the winter peak. And this is very worrisome because there's many places in Europe that continue to struggle with loss of disease. South America especially is having some of its worst time ever. Brazil is having over 3,000 deaths a day. Brazil's a big, but not that big a country. And for them to have 3,000 deaths a day is really worrisome. You'll remember they've had lots of disease for many months now and thought they were past this, thought they'd gotten to community immunity or herd immunity by having local infection, and that did not work. And so they're continuing to have lots and lots of disease. We're starting to see this spread in the Middle East. Again, it started in Israel and then moved to the outer areas, and now it's moving to other places in the Persian Gulf. So that's a worry. We're seeing an increasing number of cases in India, and although the case count per 100,000 is very low still in India, there's a lot of people in India, and it won't take much for that to cause lots of cases in the world. And then we're seeing more and more places in Africa pop up with cases. And again, Africa is my big concern because Africa's had not much disease. They've had no vaccination, and their ability to contain a pandemic is going to be incredibly difficult. In the U.S., we're at 30.5 million cases and 552,000 deaths. We're still at about 1,000 deaths a day. I mean, that's a lot when you consider what we consider to be really scourges in our society, homicides, gun accidents, auto accidents. Between them, they make up less than 200 deaths a day. So to have 1,000 deaths a day still from COVID at a time when this is coming down is problematic. The number of cases is clearly up. So again, we're not up nearly as much as the rest of the world, but when I predicted 3 weeks ago that I was worried that this rise in Europe is frequently we see a few weeks later, we're beginning to see that now. And we're seeing it especially in Michigan, Minnesota, New York, New Jersey, and Florida. And New York, New Jersey, and Florida are especially concerning because in those areas we know the variants are circulating at high rates. And these variants, almost all of them are more contagious. Some are less affected by neutralizing antibodies, but it's a real concern. Oregon's been relatively quiet, although the number of cases is starting to creep up and the number of hospitalizations is beginning to creep up. And remember, when we look at all the data, cases have a lot of variability in it due to the amount of testing you're doing, but hospitalizations don't. So again, we're also seeing a little peak in hospitalizations. We were down to as low as 3, and now we're back up to 8 in our county. At Douglas County, we seem to be stuck at sort of a background level of about 10 cases a day. Now, the 10 cases a day keeps us in the high range, does not let us go down to the moderate range, but it's very unlikely we would go to the extreme range. But again, 10 cases a day is a lot of cases. Especially when we think about a third of our population is vaccinated. We're seeing these in workplaces, we're seeing them in schools, and we're seeing them in churches. And overwhelmingly, we're seeing them in the unvaccinated population. So what we've done is we've looked at cases among the 1A and 1B group, that is hospital workers, first responders, and teachers. And when we get a case, we look to see if they were vaccinated or not. We think about 50 or 60% in each of those groups was vaccinated. Almost all of the cases are in the unvaccinated group. So depending upon exactly how many people were vaccinated, the vaccine effectiveness looks like it's between 90 and 100%. And we'll talk later today about many other studies suggest that the vaccine effectiveness, now measured in multiple different areas, appears to be 90 to 100%. So it's pretty good. We are having a big vaccine event tomorrow. We're going to be giving both the Pfizer vaccine and the Johnson & Johnson vaccine. It's going to be great. I think we're going to give well over 1,200 doses, which will make this the largest vaccine event ever in Douglas County. So we tried to go back to the polio days to see if they ever did that many. I don't think so. So it'll be the largest vaccine event ever in Douglas County. So we're starting tomorrow at 8 o'clock at the fairgrounds, and we go until 6:30. We're doing this all by appointment, and all the appointments filled last night. So we're going to have another event on the 24th. And then Aviva is having a bunch of events in cities where they have, or places where they have clinics, including Glide, Sutherland, Myrtle Creek. They had one yesterday in Drain, which was great. So that's what we're looking for. Let's go through the questions. So someone says, I hear Moderna is working on a COVID plus flu vaccine. Do you think this mRNA technology will produce more effective flu vaccines? Yes, I do. In fact, there had been some early research on mRNA vaccines that suggested they would make very effective flu vaccines. The technology we're using for flu vaccine now is, as they say, right out of the 20s, the 1920s. So what they do is they find the flu vaccine that they think is going to be circulating in the next season, and then they inoculate millions of chicken eggs. So they get fertilized chicken eggs, and they inoculate these, cut a little hole in the chicken egg, and inject the virus and infect the chick embryo. They then purify this virus, kill the virus, and then give it as the vaccine. So it's a very, very, very old technology, and I think the mRNA technology will be so much better. Barbara says, frontline workers' families are now able to get the vaccine. The governor announced that today. If frontline workers have already received the vaccine, how do they sign their family up? Well, right now, who's eligible and who's not is so ridiculously complicated. So group 6 included people 45 to 65 with underlying conditions, and the group of underlying conditions was small. But a number of things have happened now. One is they've expanded the group of underlying conditions so that I think it will find it impossible to find someone who's not had an underlying condition. And then they added multi-generational households in 7. Multi-generational households got a very complicated definition, which has changed a couple of times. And then frontline workers, and they made this complicated definition of that. Then it said families of frontline workers. I think it's not even worth doing it anymore. So we didn't pimp anybody who signed up. If you signed up, you signed up, and we're going to give you a vaccine. Again, the event for tomorrow is filled up. The Aviva events are going to take, they're allowed to take all comers. So I think, I think, just sign your family up for the next visit, for the next clinic. So the next big clinic we're going to have is on the 24th. Sign them up on the 24th, and we'll get them done. So someone says the Johnson & Johnson vaccine hasn't been approved for people under the age of 18. So what happens if it's administered to a 16-year-old? Well, just today they announced that they're doing testing on 16-year-olds. So it appears to be safe. Otherwise, they wouldn't be doing the testing. Nothing to look for. Now we generally try and follow the rules. If they say J&J is supposed to be used to people 18 above, we try really hard not to give it to people less than 18. Occasionally that happens. We had a couple of people who got their birth dates wrong and such. We've not seen any side effects, but again, we'd probably have people try and stay. But if a 16-year-old got a J&J vaccine, I wouldn't be too worried. So I know someone with an immune-compromised child would be eligible to get a vaccine. Again, we're not. The eligibility at this point is so very complicated that I don't think we're going to go ahead and ask you for proof of anything. So again, if you're signed up for a vaccine this weekend, you can come. If you're not signed up, we think we're going to have just the right number of vaccines for the people signed up. We will be we're putting a note on our DPHN site tomorrow at 5 o'clock, which will tell whether we think we have extra vaccines. And if we do, then we'll see you at the fairgrounds then. We tried to get it exactly right, but again, that's not easy to do because there'll be some people, for whatever reason, won't sign up tomorrow. They get sick, they forget about it, car breaks down, and then it's going to be hard to know. How many vaccine doses we get out of the vial. So if you have somebody with an immune-compromised child, would they be eligible? They clearly would be eligible this weekend. But if you're not signed up, wait until you can sign up. So someone asked, what percentage of the tests in Douglas County are getting genomic testing done? So the national average is about a little less than 1%. The Oregon average is 2%. We're getting about 5% of our tests getting genomic testing done. Are getting genomic testing done. So we're doing that. We still have not seen any variants since the P1 that we had back in January. So we've not seen any, but the tests are pretty slow. The Oregon State Lab started doing them this week, and they said they'd get us results within a week. So we sent some early this week, so we'll let you know early next week what they show. So that's a good thing. So somebody says, what else is going around? My whole family was sick the last 8 days, and all of us were negative. Well, there's other things that are going around, certainly this time of the year with trees blooming. There's some allergies. There are some other viruses going around. COVID's not the only one that's going around. I'm glad that the family was negative. But there's other stuff going around. Now, it turns out that when most people have upper respiratory infections, we don't know what they have. So let's take a normal year in the pediatric practice. You may see a dozen kids with upper respiratory infections. We almost never know what the virus is because we almost never send off for genomic testing of the virus that they have. So we almost never know. In fact, the only ones that we actually particularly know what the germ is strep, because we can do that specifically, influenza, which we can test for specifically, and respiratory syncytial virus, which we can test for specifically. But all the other ones are just basically guesses. So Stacy says, my father told me that the CDC announced that those who are fully vaccinated plus 2 weeks no longer can be contagious to others, including those who have not gotten the vaccine. Well, that's not exactly true. But what they said was that people who are fully vaccinated plus 2 weeks are relatively low risk for getting or giving the disease, and so they can be around those who've not gotten the vaccine if the people they're around are low risk. So that's what we call the grandparent exception. So I, as a grandparent, are immunized on 2 weeks after the completion of my series. I can visit my low risk grandchildren, and that's considered to be a safe activity. So again, 2 weeks after you are vaccinated, and otherwise low risk people. So Michelle says, I have 2 children with CF, with bad disease, ages 15 and 13. Any idea how long until their age group will be covered? So the issue isn't about eligibility. The issue is that there's no vaccine yet approved for people 13 and 15. Now, the Pfizer this week came out with data on kids 12 through 15, so the ages of these two, and it looked at about 2,500 kids who got the vaccine. There were no serious side effects among the 2,500, and there were 18 cases. The 18 cases were all in the placebo group. There were 0 cases in the vaccine group. So it looks like it's going to be that. I think that the Pfizer vaccine is likely to get approved for kids 12 to 15 sometime in April, I would think. And if it does, then they could get the vaccine soon after that. Lots of other good things about the vaccine. So people have asked again and again, how long is the vaccine good for? And what I say is, well, we can only be sure that it's good for it's only been out 6 months, so you can only say it's effective for 6 months. And the 6-month data came out this week, and the 6-month data showed that it's just effective at the 6th month as it was at the 2nd month. So it does not look like there's any decline in effectiveness, at least over 6 months. 2 months from now, I'll be able to give you 8-month data, and 6 months from now, I'll be able to give you 1 year data. But the data is very good that the vaccine retains excellent effectiveness for at least 6 months. One of the things that we've also seen is that a number of studies have come out among populations, healthcare workers, and others that got the vaccine and then compared them to others in their group who did not get the vaccine. And in each of the groups, the effectiveness of the vaccine looks to be 90% or better. We've done the same thing here. We've looked at cases among healthcare workers, first responders, and teachers, and in almost all the cases, or in people who were not vaccinated, it appears that the vaccine here is also 90% effective. So the local data, the published data, the FDA data, also centers on this effectiveness of 90% or greater. So that is great. Okay, a few more questions here. My family is fully vaccinated. The adults are fully vaccinated, and we want to get together for Easter. Our children are not vaccinated and are both immune compromised. Can we all safely hang out without our kids getting exposed? Well, so this is not the grandparent exception where you have fully vaccinated adults and low-risk others. If the children are immune compromised, I don't know what their issue is, but if they are immune compromised, they are not low risk, and then that is not considered to be one of the safe activities. Now, clearly safer that you've been vaccinated than not, so clearly getting vaccinated is the right thing, but still I would be a little concerned if they're immunocompromised, and I would then continue to use masks and distancing. So Veronica says, I thought you could be positive and still test negative and have virus. When this all started out, you said that the test can miss cases, right? So the tests are certainly not perfect. The tests are certainly not perfect, although they're increasingly good because we now understand better that for the PCR test, it's not going to be positive on the first or second day, only occasionally on the third day. It starts to be turned positive on the fourth and fifth day, and then can stay positive for many days or weeks after, even when you no longer are contagious. So I think we understand that well now. We also understand that the rapid tests, which look for the protein rather than the DNA, don't usually turn positive until the fifth or sixth day. They frequently then become negative again by the 9th, 10th, or 11th day. And so could you be positive and still test negative and have virus? A little hard to know, but yes, none of the tests are perfect. And so again, if people are sick, we have them stay home until they're better, because you could miss some cases. That would be a false negative test. We occasionally see false positive tests where people we do not think have the disease test positive. But as we have more and more experience with this, we recognize that those small numbers of false negatives and false positives are very important for the people who have the false positive, false negative test, but they're very small in comparison to the whole group. Similarly, with the number of presumptive cases, which early on was a big area of contention, again, presumptive people are people who've had close contact with somebody who's sick and don't yet have a positive test, either because they've chosen not to get a test, they got a test that's pending, or they got a test and is negative and we're waiting for a repeat test. And so the number of presumptive cases is decreased because we're understanding better and better how to test. So Scott says, what do we know about vaccinated people that have actually gotten COVID? Did it lessen the illness? And the answer is yes. So when they've looked at both the studies, the original studies that they did to approve the vaccine, is that the people who got the disease typically had mild disease. In fact, I looked at the numbers today for the J&J, the Moderna, and the Pfizer, and the number of people who have been fully vaccinated and then need to get hospitalized, so more severe case, is just a handful of cases in the entire group. And that's kind of what we've seen here, is that the people who've had the vaccine and then test positive have had relatively mild illness. So the vaccines seem to be best at preventing death, very good at preventing hospitalizations, good at preventing symptomatic disease, and still pretty good at preventing asymptomatic disease. Because many of these new studies looking at the effectiveness of the vaccine have not only looked for symptomatic cases, did you get sick, but they've also had groups of people swab their nose every week to see if they get the virus. And not only does it prevent symptomatic disease, but it seems to prevent asymptomatic disease, so that's great. So does taking an antihistamine affect the COVID shots? We do not think so. So if you want to take an antihistamine, that is perfectly good. Now there's one drug that we have studied, and there's a drug called Remicade, which is a drug that people would use for arthritis, and that does seem to decrease the efficacy of your response. That's not surprising. The way these work, and you probably see these advertised, it seems like every other commercial is Enbrel and Remicade and Taltz and all these different things that you use for different disorders like psoriasis and arthritis and Crohn's disease and whatever. They all affect your immune system. So, for example, Remicade works by decreasing your tumor necrosis factor, which is one of the cytokines that is involved in arthritis. And since it blocks the cytokines, it's not shocking that it would block your immune response, and it does seem to block the response to the vaccine a little bit. Vaccine still seems to work, but not quite as high if people are not taking Remicade. Again, that's no shock at all. So for people who are taking one of those immune modulating agents, Enbrel, Humira, Remicade, any of those things, you should talk with the doctor who prescribes those to see if they have any special recommendations about that. Some of the doctors, for example, have been saying, why don't you hold on your Remicade dose in the week before you get it, but please, please, please talk to the person who prescribes it for you. Now, one of the questions that's come up this week has been about the AstraZeneca vaccine. And the AstraZeneca vaccine is really the problem child of all the vaccines. So among the Moderna, among the Pfizer, among the J&J, these have been very extensively studied. They've had really clean records all along the way, and they're out. And the United States has given millions and millions of doses of these, and we've really not seen any bad long-term side effects. And so that's been a really, really good thing. Now, the AstraZeneca is problematic. So the AstraZeneca was just a chimp adenoviral thing. They had a bunch of troubles with their trials. And now what they're saying is some of these unusual cases, so they've given 9.2 million doses in Europe, and 62 people have had an unusual reaction where they've had clotting and low platelets. So clotting and low platelets is not a very typical thing. So to have 62 cases of the 9.2 million probably is important. That's 1 in 100,000 or so of people are going to have this reaction. That's low. Clearly, your risk of death from COVID is far higher than that, but still, that's going to make people very, very wary about the AstraZeneca vaccine. It is likely to go for FDA approval later this month, and it'll be fascinating to see what happens. But for right now, the vaccines that we have now, the Moderna, the Pfizer, the J&J, given to millions of people, and that we've not seen more safety signals is a little surprising, but those seem to be incredibly safe and incredibly effective vaccines. So Veronica says, are you concerned that there will be fewer cases diagnosed since you're not going to continue to do the drive-through testing? Well, the drive-through testing had gotten to the point where we were doing very few sick people. We were just doing preoperative studies for out-of-area surgery centers. So it's not going to change the numbers because those people will still get the test. They'll just get them elsewhere. So I don't think it's going to be that. Now, the one thing Veronica notes is that many places seem to ignore symptoms. And this is something we really try to point out, is that the symptoms of COVID are so really varied. I will tell you just this week, and like we say every week, that we see people, they're diagnosed, like the one we had today. A guy was diagnosed, works at one of the large stores in the area, and was sick for a week before they went and get to, I just thought it was a sore throat. I just thought it was a sinus thing. I just thought it was a bad cold, and didn't get tested in front of them. They had COVID and may have spread it to many others. So again, early on, COVID is so really hard to know what's going on. So during this time, while COVID is still spreading, we ask people to don't go to work if you're sick. If you're still sick the next day, to get tested for COVID. If the COVID test is positive, really continues down. Even if it's negative, you should still stay home until your symptoms are better. And I would agree with you. There are a lot of people who are ignoring the symptoms. And unfortunately, those are people then who lead to lots of spread because they're ignoring the symptoms. They go to work and spread it to others. So Joan says, how do we sign up for the vaccine shot? We're 58 and 60 years old. So in Douglas County, there are over 40 different ways to get vaccines. So we looked at this. I think we have the most different places of any county to get vaccines. So there are more than 40 ways in the county to get vaccine. The best way, I think, is to call your doctor. Almost all of the big clinics in town, almost all the docs in town are giving the vaccine. This includes our big clinics like Aviva, like Evergreen, like South River. It includes some of our single doctor offices like Dr. Jaworski's office, Dr. Todd's office, Dr. Jones' office, they're giving vaccines. So that's far and away the best place to get vaccine. If not, there are 18 pharmacies in the county that are giving vaccine. And so I can't think of one that's not. So almost all the pharmacies in the county are giving vaccine. So you can go to one of the pharmacies. In addition, we're having a big event this weekend. You're too late to sign up for this weekend, but the next one on April the 24th, we're going to open. It's a Saturday event. We're going to open it on Tuesday. Our event this time was open for 50 hours. I imagine this next one's going to be open for a similar amount of time. So if you sign up somewhere this next time, you'll be able to go in and get a vaccine. Okay, a couple more things that we have here. New symptoms. This is an incredible virus that after a year later, we're still finding new symptoms that are caused by this. One is non-convulsive seizures that people who are very sick have. So people know about epileptic seizures where people have rhythmic movement of their arms and legs and lack of consciousness. These seem to be people who are quite sick in the ICU who don't have the arm and leg movement but continue to have that high level of brain activity. And that might be one of the reasons that people who wake up after having COVID in the ICU frequently are really quite confused, loss of memory, poor functioning. It may be because we're having these non-convulsive seizures while they're sick, and it's really taking a toll on the brain. And when we look, COVID really takes a toll on many organs. So this is primarily a lung disease, and a lot of the people have lots of lung issues. We're seeing more and more stories of people having lung disease and then having bad lung disease and now needing lung transplants. We're seeing people on this ECMO, this heart-lung machine, for weeks or months at a time, and then spending long time in the hospital. We have one fellow now, relatively young fellow, who's been in the hospital for a couple of months now. And so that really is a concern. But we're seeing other effects on the spleen, on the liver, on the kidneys, on the brain, on the heart. So this is really a bad disease. One of the other side effects that was talked about is COVID arm. So typically with the Moderna vaccine, although it can happen with any of the vaccines, so you get a red itchy area on the arm a week or so after you get the vaccine. And for most people, it's kind of a bother. There was one case reported this week of somebody who scratched at it so much that they actually damaged the skin and needed to be hospitalized. Again, that's really quite rare and not surprising. Anytime we give vaccines, you can get redness and soreness when you get the vaccine, so that's not problematic. So someone says, how can I get my 16 and 17-year-olds vaccines? Again, the only vaccine that's approved for 16 and 17-year-olds is the Pfizer vaccine. Not every place has the Pfizer vaccine, but you should go ahead and call their doctor and see. As I said, I think the J&J vaccine and the Pfizer vaccine may get approved for younger age groups, but not yet. The vaccine that we're giving at the drive-through clinic is the Pfizer vaccine. So if you can't get it before then, they could definitely get the vaccine on April the 24th at the fairgrounds. Again, that's going to be another drive-through event. April 24th, we're going to sign up for that in the week before so they could get that. The other one is my daughter is disabled and my son has ADHD. Are they eligible? I looked at the list again today of the the underlying conditions, and I've been doing this a long time, and even for me it was really confusing because what the list didn't include. The list just had these broad lists of disease, sort of cancer. So the story is, does that mean you have cancer now? You had cancer before? You have a little skin cancer? Does it mean that you're in chemotherapy or not chemotherapy? You talked about asthma. Does that mean I had a history of asthma? I have asthma now. I'm on a high. And so there's no way for us to figure this out. Right? If we were going to do this with everybody we were scheduling, it would take 20 minutes to schedule you as we move through all the groups. We just want to get you in. We'll just get you in and get you done. And if somebody later comes back at me for saying, "Oh, we didn't probe enough to see if people met the criteria," so be it. We just want to get people vaccinated. So again, 16 and 17-year-olds can get that. So ADHD, I did not see on one of the things, although it just said neurologic conditions, and ADHD is I I guess, a neurologic condition, so it's hard to know. Again, we think anybody who's otherwise age eligible, that is 16 and above for the Pfizer, 18 and above for the J&J and the Moderna, should just get the vaccine. Okay, well, a couple of other things. One is that this week the CDC said that people who are fully vaccinated can travel. That's a good thing. It's another reason to get fully vaccinated. And still they're saying that while you're traveling you should wear a mask and distance, but that travel in and of itself, both on airplanes or in cars, seems to be safe. We think bus travel is still a little bit of a worry, and we're still a little bit worried about mass transit because those are areas where they don't have particularly airy stations or good ventilation. On airplanes, though, they have great ventilation, some of the best ventilation around. And airports themselves tend to be these enormous buildings, and they've really beefed up the air handling in those places. So we think travel by air is probably going to be safe. I mean, the concern is that you are going to be sitting right next to somebody for a while. If you're vaccinated, again, your risk of getting disease is pretty low, but again, you're really close to a person for a very short period of time, for a very long period of time. So I'd still wear a mask, and actually that would be a time I would double mask, because I would be a little nervous about that. Okay, let's see what else we have here. So they're working on a question here. Aviva is doing some events. They're doing events on the 6th and 8th in Sutherland, on the 7th and 14th in Myrtle Creek, and on the 12th in Glide. So they're really up in the game here. They did an event in Drain yesterday, just a lovely event at that lovely Drain Event Center, and it went beautifully. They used the J&J vaccine yesterday, and it worked great. And so we're really just encouraging everybody to get vaccinated. Now, you may have heard that there was a goal that everybody should be able to get a vaccine within 5 miles of where they live. And I look at that saying, I grew up in New York City. Within 5 miles of New York City, that's like everyone. That's like 8 million people within 5 miles of New York City. That's not really hard. But when you start getting places like Douglas County, it gets a lot harder because our county is the size of the state of Connecticut. Now, Connecticut has millions of people in it, and we only have 112,000. So obviously, to get a vaccine within 5 miles of 90% of the people who live in Douglas County is not going to be easy. But I think we're going to do it. Our Tiger team is now ready to go. And the Tiger team is going to visit some of those really remote areas, Togedy, Tiller, Days Creek, Elkton, down in Wolf Creek. They're going to visit all those really remote areas to be sure that for people who do have trouble traveling in those areas, that they can come and get vaccines. So that is great. All right, so Zachary says, is there a level of COVID in the county where not wearing masks would be acceptable, considering that people are getting vaccinated already have antibodies from previous infection? We're not close yet. We're not close yet. So we're still seeing a fair amount of disease spreading. But is there a time? Yes, there is a level of COVID in the county where I think we could move back on that. And what that is has not been decided yet. Right now, we're averaging about 10 cases per 100,000 people per day. Certainly it's not at 10 cases per 100,000 a day. We're still seeing a lot of cases. If we got down to 1 case per 100,000 per day, that would be about 40 or 50 cases a day. In Oregon, I think yes. I think at that point, then we would be at a low enough level that we might be able to consider getting rid of masks and social distancing and any restrictions and treat this just like other diseases that are relatively uncommon. But to get down to 1 case a day, we could do that in a couple of ways. One is we get a lot of people vaccinated. That would bring the case rate down. We could improve our social distancing and whatever so that our rate cut down to 1 a day. So there's a bunch of different ways to go ahead and get there. Right now, we're not, we're at 10, so we're 10 times higher than that. Now, in terms of the number of people who have been vaccinated versus the number of people who've had the disease, there are now far more people vaccinated than have ever had the disease. And because the disease doesn't give you as good antibodies as the vaccine, almost everybody who's got protection has protection from the vaccine rather than from the previous infection. So again, we're getting there, and we can get there quickly. We're going to have a fair amount of vaccine over the next month, and we'll be able to do it. But one of the real disappointments has been the news that came out this week that the Johnson & Johnson vaccine, which we expected to get a lot of in April, so during March, the people from the state were saying, "Oh, you'll have to figure out how to get rid of 40,000 doses of J&J in April. You have to set up all these things so you can use 40,000 doses of J&J." And we did those kind of things. It turns out that our total amount for April is going to be 1,500 doses of J&J. So instead of 40,000, it's going to be 1,500. So that's a real disappointment, and that comes from a couple of problems. One is that the J&J delivery of the vaccine that was made in Europe is slower than was predicted. But the other issue is that there was a factory in Baltimore that was hired to make this vaccine. They had about 15 million doses in the works, and it turned out that they had a manufacturing problem, and all 15 million of those doses needed to be scrapped. In addition, because the places had troubles, they stopped making new ones. So instead of getting millions of doses of J&J vaccine over the next month, we're probably not going to get very many at all. So that's an incredible disappointment. Now, it doesn't mean that the system worked, right? It does mean that the oversight system that the FDA and others use for drug manufacture worked, and we were able to find this before this got out to anyone. So that's the good news. The bad news is we're going to be a little delayed in our delivery of J&J. And J&J has been popular. When we did our event this weekend, we have 200 doses of J&J and about 450 new doses of Pfizer. And the J&J sold out very quickly, and the Pfizer, not so much. All right, so the Eventbrite link at the DPH website will say that tomorrow's event is sold out, and it is. We have had occasional cancellations where people have canceled because they decide they're not going to be in town tomorrow or something else. So we've had maybe today about 5 or 6 cancellations that we've filled up with people from the waiting list. But we're going to open ticketing for the 24th. 24th is Saturday. We're going to open it up on the Tuesday before. And again, we expect to have lots of doses of vaccine. There's probably going to be mostly Pfizer. We expect to have lots of doses of vaccine. So for the 16 and 17-year-olds who want to get it, for the people who have immunocompromised people in the family, for the families of frontline workers, the 24th would be a great time to get it. If not, you can get it before. Again, I've talked to many of the pharmacists in town, and they've not been filling. Right, so I talked to one of my friends who works at one of the pharmacies, and they said, geez, almost every day we decide we're going to give so many doses. I think they have Moderna, and they don't have enough people for the 12 doses, and they have to announce sort of over the loudspeaker, anybody in the store want to get a vaccine. So it sounds like there's pretty good sign up if people want to get it, so I'd encourage you to do it. And as I said, so many of the pharmacies in town have it. So really check with your pharmacy or check with your doctor. Of course, our goal would be to get enough people vaccinated that we are down to the 1 per 100,000. We can get rid of these darn masks. So the next question, with more people getting vaccinated in our county, will public school quarantine guidelines change? Not yet. So we're still not at a low enough level that you could say, oh, you don't need to quarantine because everybody's vaccinated. Now, people who are individually vaccinated do not need to quarantine. So if you're a teacher in school and one of your students has it, the teacher does not need to be quarantined if they are fully vaccinated. Now, we'll also get to the point where we'll start to vaccinate maybe kids 12 to 18, and then kids in high school who are in a classroom where somebody else has it will not need to get quarantined, and so that's great. So Cheryl says, do we have to get a ticket for our second dose? So tomorrow we're going to be doing second doses between 10 a.m. and 3 p.m. for people who had, so for people who got a vaccine on the 13th, we've made another appointment for them at exactly the same time tomorrow. So if you had an appointment at 10:45 on the 13th, you have an appointment tomorrow at 10:45, and we have a list of all of those. There were some people at the end, about 50 people at the end, who got what were these extra doses, and they all have appointments, and we made them at 2 o'clock. So it's going to be a little surge at 2, but there's nobody else scheduled until 3. So we have a long time for those extra people to get their second doses. So again, you do have a ticket. You don't need a ticket, but you already have an appointment for exactly the same time as you got your other dose. So Veronica says, do people with AB blood have more problems with COVID? So yes, it is different with different blood types. And so different blood types do seem to be about a 10% difference in their problems with COVID. And yes, AB does seem to be more of an issue than O. There are slight differences in the blood in terms of the antigens that are on the blood cells and how our body reacts to them. So we don't exactly understand why that should make a difference. But there does seem to be a small difference with AB blood. But there's a bunch of things that seem to make a small difference. Age makes far and away the biggest difference. Blood type makes some difference. Wearing glasses makes some difference. The number of people you're around clearly makes a difference. So there's some people kind of homebodies, stay at home all the time. They tend to have very low risk of disease as opposed to people, for example, who have jobs where they're around lots of people and very close. So there's lots of things, and when the story of COVID is written, we'll be able to find out more of these. Now, blood type is not one of those things you can easily change. And so those are important, but not something you can do anything about. What I prefer to focus on is things that people can do something about, and that is wearing a mask, social distancing, and maybe even wearing eyeglasses. Okay, so one of the questions that comes up is where we're going to be in risk range. So the risk time ends this Saturday night at midnight. It looks like we're going to be somewhere between 130 to 140 cases per 100,000 over 2 weeks. So if we're over 200 cases per 100,000 over 2 weeks, we go into the extreme range. We'd have to have a bunch of cases. I don't think that's going to happen. To get into the moderate range, we'd have to have less than 100. We're already past that. So it looks like, with about 95% assuredness, we're going to continue in the high range over the next 2 weeks. That's still too high. I mean, that's still too high for me. I mean, I'd really, really, really like to get this down so it's low. So again, what we've seen outbreaks. They've been largely among the unvaccinated. So we had 2 outbreaks that I'm especially familiar with. Again, everybody who was not vaccinated got the disease. Nobody who was vaccinated got the disease. It's pretty striking. In another place, most of the people were not vaccinated. All the people who were not vaccinated got the disease. So it really does seem that the vaccine works. And with 10 cases a day, we're going to stay in this high range, which for me is ugly. I mean, I'd love to go to a place where the bars and the restaurants were more open, the gym was more open, and where we could think about getting to a point where we could start getting rid of masks and social distancing, whatever, but we can't do that until our case rate gets really, really much lower than it is now. And looking at the case rates in the rest of the country, we could be for a bad time. I mean, looking at the heat maps around the country, Michigan and Minnesota look just terrible. They look every bit as bad as they ever did. In South Florida, where there are a lot of people over the last 3 weeks for spring break, South Florida is very worse. I mean, it's very worse because they're also having a lot of variants. And the variants seem to be much more contagious than the typical kinds. So the B117 and the 351 and the P1 all appear to be much more contagious than the original ones. And the concern is when it's much more contagious, it just spreads much more. And do we know about variants here? Again, we've not had any new variants since that one in January that came from Brazil. But one of the things that they do is they look at wastewater. You may have seen this on TV. You can look at the wastewater, the collected wastewater from a small area, and look to see both how much of the COVID RNA is there, but you can also see what percent of the RNA that's there are variant types. And so it may actually be the best use for this wastewater analysis. And this wastewater analysis now starting to show variants in places that haven't seen a lot of cases of it, but it's starting to show up in the wastewater, which means it must be there. So Grants Pass had some this week, Corvallis had some. So, the real worry is that we'll start getting these variants, and then when we get the variants, the disease will spread that much faster, and at least for the B117, it may be more serious, so you have more people hospitalized and more people dying, and that's really where we don't want to be going this Easter season. Really, this Easter season, we really want to be opening up. We want to be spending more time out there with friends and family. Again, outdoor activities much safer than indoor activities. So somebody asked me a question this week about, what about Little League? Little League, pretty safe. You're kind of doing it outdoors. The kids are all in their position, so they're all fairly distant. So Little League, pretty darn safe. Indoor poker party, still a little bit of a worry. But an outdoor event like that, outdoor event like Little League, pretty safe. An outdoor running event, again, pretty darn safe. We have seen some cases among sports teams, but again, usually with the sports teams, it comes from locker room, weight room, training room, showers. It comes from those kinds of areas rather than the playing field itself. All right, well, we're getting to the end of our time here. A couple of things. One is our big event tomorrow. It's again, if you have a reservation, please, we'll see you at the time. There's no need to come an hour early. In fact, coming an hour early just gums up the work. So come at around your time. We'll get you in there. Our goal tomorrow is to get people in and out very quickly. I think we've sped it up a little bit since the last time, and so that will be great. We're expecting, again, over 1,000 to give over 1,000 vaccines tomorrow. We also hear that the weather is good, which is a great thing. And then we're going to have our next event on April the 24th. And again, the sign up for that is the Tuesday before. You can sign up for that. You don't need a ticket for tomorrow, but you should have an appointment. They'll check your name off the appointment list tomorrow when you get there. Other than that, be safe and be kind. Again, we're really, really close, guys. This is maybe the most optimistic I've felt about this pandemic in a long time. I think the vaccines are going well. I think the vaccines are showing that they're really effective. And for the most part, we've not had a lot of monkey wrenches in the system. So I think things are good. So my plea around this Easter season is be safe and be kind, and we'll do this again next week. Thanks.